They are celebrating a very important milestone. They have just completed their 100th mako shoulder surgery.
How about that? The technology is considered to be a game changer when it comes to shoulder surgery. And joining us this morning to tell us more about it, Dr. Amara Anbari, orthopedic surgeon at Backus Hospital. Doctor, good morning. Thank you so much for being here.
Thank you so much for having me. Good morning.
You look like you're right in the middle of it right now. I'm so glad to have
It's
you
my
here.
it's my surgery day, so welcome to my OR.
I
All
love
right.
it. That's perfect. This is an amazing milestone for you in all seriousness. For those who may not know, what is the Mako robot? Can you tell us a bit about it?
First, so the Mako robot, which you see next to me, is a fancy computer that has a mechanical arm that allows us to do certain parts of surgery, and has a monitor behind me with camera eyes that allows me to see exactly what's going on during the surgery, even in very, very tiny spaces. So it allows me to do the surgery without doing a lot of dissection,
Right.
and which makes the surgery a lot easier and faster, and doesn't take us long to recover from it.
Doctor, why is that robot so important when it comes to actual shoulder replacement?
So we've seen the results we've had with hips and knees. For the past 12 years, we've been doing hip and knee replacements using the robot. The shoulder, in my opinion, is one of the most important joints in our body because it allows the hand to go in certain directions. So when we replace the shoulder, we want to make sure that our prosthesis that we put in there gives our patients the best range of motion possible. Well, the robot makes that very easy to do by allowing us to do different simulations of different positions of the prosthesis, and then we can decide which one will be the best one that will give the patients the best motion possible, which is the reason why the robot has become very important for that.
Wow, it's so great to know that this exists in our healthcare system. What makes this procedure so unique to Hartford HealthCare?
Well, Hartford HealthCare and we're the first and right now the only healthcare system in the entire region, New England and the Northeast, that's actually offering this surgery to patients. We have done over 100 so far, and some of my co-designers who have actually worked on this implant and this application have now done over 500 of them. So now we're confident
Wow.
that the results we have are great.
Doctor, final question. What does this milestone mean for you personally, and how are your patients doing so far?
Well, I mean, obviously, it's just a number. It doesn't really mean anything
Right.
specific. It's a huge honor to be able to do that. But but the bottom line is, I've seen the patients after surgery and compared them to how the literature has for range of motion, and we have exceeded the range of motion by at least 10 to 20 degrees compared to what we used to do in the past, which is going to give patients a lot more motion, a lot more recovery, and ability to do things they wanted to do from before surgery.
Incredible. Changing lives, Dr. Anbari. Thank you so much for your time today. Appreciate it.
Of
And congratulations,
course.
of course.